Disclaimer: We Level Up is not promoting the use of melatonin. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: Can you overdose on melatonin for adults? What is melatonin? Melatonin is a natural hormone produced in the body that plays a role in circadian rhythms. It is used in dietary supplements. It is a hormone that your brain produces in response to darkness. Melatonin is a hormone your body naturally makes to help keep your sleep cycle consistent. This cycle is also known as your circadian rhythm. This is also sometimes called the biological clock. Melatonin may be an effective and safe treatment of chronic insomnia, sleep anxiety, and insomnia caused by jet lag or shift work. Individuals sometimes use alcohol to self-medicate from insomnia and combine melatonin and alcohol. Melatonin plays a major role in maintaining your sleep cycle. Your body produces most of it in the hours after the sun goes down. Most of it is made, especially between 11 p.m. and 3 a.m. Being exposed to light at night can block melatonin production. Research suggests that these hormones play other important bodily roles beyond sleep. However, these effects are not fully understood. Melatonin dietary supplements can be made from animals or microorganisms but are often synthetic. Can you overdose on melatonin for adults? Melatonin is a hormone that your body naturally makes. Taking too much can result in a melatonin overdose. The supplement is sold as an OTC or over-the-counter sleep supplement. While it is difficult to say how much melatonin use is too much because there is no standardized dose, taking too much can result in adverse side effects. That's why starting with the lowest dose possible may be wise and working up from there in consultation with a healthcare professional. So, can you overdose on melatonin for adults or children? It is possible to overdose on melatonin, especially if taken in large doses or over prolonged periods. The recommended dosage for melatonin supplements usually ranges from 0.3 to 5 mg daily. Taking too much melatonin may cause symptoms such as nausea, dizziness, headaches, or increased anxiety. It can also cause other side effects, such as excessive drowsiness, disorientation, and confusion. Long-term use of high melatonin may lead to disrupted sleep patterns, decreased mood, and decreased cognitive ability. Melatonin overdose death dangers. Can melatonin cause death? Can you overdose on melatonin for adults? Generally, too much melatonin can lead to unwanted side effects. An overdose of the supplement could rarely kill you. However, melatonin overdose death may occur when mixed with other substances. Melatonin and alcohol death occurs because both drugs are sedatives, so there is an increased risk of accidents or over-sedation. Melatonin and alcohol. People with sleep disorders sometimes use alcohol and melatonin to self-medicate. Generally, it is not recommended to consume alcohol while taking melatonin. Alcohol can disrupt the natural production of this hormone and intensify some of its side effects. Alcohol is a known depressant that can increase drowsiness, and when combined with melatonin, it can cause excessive tiredness, lightheadedness, and problems with coordination. Additionally, consuming alcohol before going to bed can also negatively affect the quality of sleep and could potentially reduce the effectiveness of melatonin in helping regulate your sleep-wake cycles. Studies have found that approximately 30% of people with ongoing insomnia have used alcohol within the past year as a sleep aid. Alcohol and insomnia are strongly connected. Estimates of insomnia in people with alcohol dependency range from 36% to 67%. Furthermore, it is common for individuals suffering from sleep disorders to combine melatonin and alcohol. 2. It's best to avoid combining melatonin and alcohol and follow the recommended dosage and timing of the supplement to improve your sleep quality. Always consult your healthcare provider before starting any new supplement, especially if you have underlying health conditions or are taking other medications that might be affected. It is worth noting that according to the National Institutes of Health, NIH, the FDA does not regulate melatonin supplements. Consequently, melatonin is not officially FDA approved for any indication. However, melatonin receptor agonists such as Ramelteon and Tasimelteon are FDA approved for treating insomnia. Non-FDA approved indications for melatonin include insomnia. Is melatonin addictive? Since melatonin supplements imitate a natural hormone, the human body can't build up a tolerance to it or experience melatonin withdrawal symptoms the way it would with a medical sleep aid. However, you might experience some mild melatonin side effects while taking melatonin supplements. Melatonin is a naturally occurring hormone in your body that helps promote sleep. Your pineal gland releases melatonin into your brain at certain times of the day. It releases more at night and slows production when it's light outside. As you age, your body makes less melatonin. Melatonin is an over-the-counter supplement in the United States, typically available near vitamins and supplements. However, just because something is natural doesn't make it automatically safe. Synthetic melatonin is human-made, with a chemical makeup designed to mimic natural melatonin. It would be hard to call melatonin unsafe in any meaningful way. However, it is worth noting that because of its classification as a supplement rather than a drug, it is not regulated by the Food and Drug Administration, FDA. Melatonin dosage. How much melatonin is too much? Are you searching for, can you overdose melatonin? And what happens when you overdose on melatonin? And how much melatonin is too much? Excessive consumption can cause lethargy, disorientation, and low blood pressure when taking more than prescribed melatonin. What happens when you take too much melatonin, and what are the standard doses? To help you answer, what happens if I take too much melatonin? Refer to the information below, but always consult your doctor, as each person's drug response varies due to different factors. 10 milligrams dosage. Is 10 milligrams of melatonin too much? Are you wondering, is 10 milligrams of melatonin too much? 10 milligrams of melatonin is the highest dose typically used for treating sleep-related conditions and hasn't been associated with toxicity. 10 milligrams was the dose used in one study to handle circadian rhythm disorders in people who are blind. The study concluded that a physician should always supervise this high dose. 20 milligrams dosage. The 30 milligrams dosage is substantial. Is 40 milligrams of melatonin too much? It depends on your condition. Some studies have used 20-40 milligrams doses to prevent and treat clot-forming cells, thrombocytopenia, associated with cancer chemotherapy. So if you're asking, is 36 milligrams of melatonin too much? Consult with a doctor regarding your case. 100 milligrams dosage. So, how much melatonin is too much? 100 milligrams melatonin dose is a serious amount that shouldn't be used. With this in mind, it's necessary to note that this would result in many unwanted effects, potentially harmful. What happens if you take too much melatonin? Can it lead to melatonin addiction? Melatonin is generally safe for short-term use. Unlike many sleep medications, you are unlikely to become dependent on melatonin. However, you may get your old symptoms back. If you are on a high dose, your doctor may advise you to reduce it slowly before stopping it completely. How much melatonin is safe to take? Melatonin is available to purchase in any quantity without a prescription in the US. However, there is currently no formal consensus on the optimal dosing regimen for this supplement. Studies frequently use doses ranging from 0.1 to 10 milligrams, but 2 to 3 milligrams is often considered an appropriate starting amount. What if I take too much melatonin? There are many challenges to determining the appropriate amount of melatonin for anyone to take. Individual responses to this supplement can vary considerably due to factors that are not fully understood but can include age, gender, specific sleep issues, other health conditions, and timing of administration. Moreover, not all melatonin supplements are created equal. Differences in preparation can significantly alter its impact. What happens if you take 10 melatonin? Is 10 milligrams melatonin too much? Depending on the formulation, taking 1 to 10 milligrams of melatonin can raise the body's melatonin blood levels anywhere from 3 to 60 times the average amount. If you are having trouble with alcohol and insomnia, and self-medicating with melatonin and alcohol, talk to us, and we will help you find an effective treatment for both. We Level Up New Jersey Addiction Treatment Center can provide proper evidence-based therapy. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.